Now, hemostasis is divided into two steps, and that's called primary hemostasis and secondary hemostasis. When we are talking about primary hemostasis, we are primarily talking about platelet plaque formation, and that's when there is an injury to the vessel wall, and these platelet plaques come and aggregate here and form the platelet plaque. Now, after that, because these platelet plaques are not stable themselves, we need coagulation cascade to initiate and form a clot that stabilizes this platelet plaque, and that's the secondary hemostasis. Now, as I told you earlier on, primary hemostasis goal is formation of platelet plaque, or in other words, white thrombus. And secondary hemostasis is activation of coagulation cascade, which result in the formation of fibrin clot or red thrombus, and that stabilizes the primary hemostasis. Now, in next slide, I want to tell you more in depth that how primary hemostasis occur. So the primary hemostasis is divided into different steps. The first step is initiation, and in this step, when there is a damaged vascular endothelium and there is exposed collagen, these area or these sites, it attracts von Willebrand factors, and von Willebrand factors comes and sit there. Now, you may ask yourself where all of these von Willebrand factors are coming from. Now, there is normally there are two sources for these von Willebrand factors. The first one is viable plattibodies, and the second one is platelet itself. So platelet can release von Willebrand factors, and also viable plattibodies in the endothelium can release all these von Willebrand factors. Now, second step is adhesion, and in adhesion, what happens is that all of these platelets, they have a receptor called GP1B, and this receptor, what it does is that it connects these platelets to the von Willebrand factors. And after connection or linkage of these two together, the third step, or the activation, occurs. And in this step, via ADP, there comes an activation steps or activation of a secondary receptors called GP2B3A, and these receptors participate in a formation of platelet plaque via bonding to fibrinogen, and these fibrinogen then bind to another platelet. So these platelets bind together and form the platelet plaque. Now, after formation of platelet plaque, this platelet plaque is not as stable, so we need the secondary hemostasis to occur and stabilize and form the clot and stabilize this platelet plaque.